Fighting COVID-19 is a part of Shelby County Health Department's work to combat infectious disease, but we do much more to promote, protect, and improve health in our county. We work behind the scenes to monitor air and water quality, protect the environment, ensure food safety, and promote healthy living. And we're using data science to address emerging threats like overdoses and violence to build a safer community. Health for all is our commitment at shelbytnhealth.com.
Welcome back, everybody. Next speaker is Miss Naomi Taylor. She is a public health coordinator. A little bit about Naomi. She is a graduate of Lemoyne College right here in Memphis, Tennessee. A magician, right? Naomi has worked for the Shelby County government for, get this, 22 years. Retirement's coming up soon, right? Insight. She's worked in various areas of Shelby County government, but her love lies in public health. Naomi joined the Population Health Department about 3 years ago, where she became the public health coordinator for the Opioid department. She's a coordinator for the first response and law enforcement pillar, as well as the harm reduction pillar. Naomi loves working with the public and helping others. She works with community stakeholders, such as residents, schools, churches, neighborhood associations, and community-based agencies to plan and participate in community events like Stop and Start. She helps to inform and educate the public on the danger of the opioid epidemic. Welcome to the stage now, Miss Naomi Taylor.
Okay, y'all gave me some music. All right. Good afternoon, everyone. Good afternoon. I know we've all had lunch. And once we have lunch, sometimes we can get a little tired and sleepy. So we want you to wake up and listen. I have a lot that I was gonna present, which I'm still gonna have to go over it. But earlier this morning, a lot of people took a lot of my slides. they took a lot of things that I was gonna say because this is an opioid summit, right? So what we're gonna do is kind of do a little review of what you all have already learned. Okay, we're gonna try to review the class of drugs called opioid. We're gonna go over the impact that the opioid epidemic is having on Shelby County, as well as review about fentanyl and why fentanyl is dangerous, and how one pill can kill, and the harmful effects of stigma. Okay. All right. Okay, so earlier today, everyone heard about opioids, right? So by now, everyone knows what opioids are. So can you all tell me, without looking up here at this, what are opioids? And what are opioids? Somebody yell it out in the audience. Yes, yes. Opioids can be pain medications as you normally prescribed by the doctor for pain, like if you had surgery or something like that, then they would give you some opioid. Some of the prescription opioids are things like codeine, morphine, Percocets, and all of that. And we also have illegal opioids like heroin, and then Fentanyl is a legal opioid, but it can be illegal as well. Okay, so what we're gonna do now, I have a lot of videos because I didn't want to bore you all, and I didn't want you to sit up and listen to me for 15 minutes talking. So I did pull a lot of videos into my presentation as well. So we're gonna look at this video is someone having an overdose.
Hello, get the motion.
We got my.
Got it?
I never did it. I never did it.
Hold up. Slide it back.
Naloxone or Narcan can help restore breathing during an opioid overdose. Although lay rescuers are encouraged to search and administer naloxone, it should not delay basic first aid measures.
She already got 2 nasal.
Hold it tight.
Her hands are blue. She just had 2 nasal.
Somebody get that oxygen thing.
It is recommended that those whose job may involve responding to opioid poisoning, example peer support, outreach workers, be trained in full CPR protocols to the BLS level and have access to both naloxone and proper PPE.
Thank you.
The lot.
Okay, so on that video, we see that this young lady was having an overdose. Now, for any emergency, what is the first thing that you should do in case of any kind of emergency? Can hear you all? Exactly, call 911. And so you heard also on there, they were saying, give her 2 nasals they've already given her 2 nasals. What they were referring to was Narcan. And I know all day today, you all have heard about Narcan, what Narcan is and how it's, they give that for, to help with the reverse overdose effects. So first of all, you want to call 911. And then if you have Narcan on hand, you want to quickly administer Narcan to the patient. Okay. And then if the patient is unconscious, what should you do if they are unconscious? You do CPR, that's true. And what else? You want to also put them on their side because if they're unconscious and they're not alert, they're not awake, you want to put them on the side so they don't choke in case they come to, you know. And if they are conscious, what do you want to do? You want to try to keep them awake. You want to keep talking to them, make sure that they don't go, go back unconscious. You want to continue to talk to them. You want to make sure that they stay awake until the EMT get there. Okay, and Narcan is what you give the person, like I said, if they are actually having an overdose. It doesn't matter whether you know what kind of overdose they're having. Narcan will not hurt them. Okay, it's not going to hurt them at all if you give them the Narcan. So if you have Narcan on hand, that's the second thing you want to do after you call 911. Now, like we said, you can get Narcan from the pharmacy as well as from the agencies that we have here in Memphis, which the health department, we do not give out Narcan. We have so many people ask us, you all have Narcan, can you give me some Narcan? But what we can do is refer you to these wonderful, wonderful community partners that we have. We do partner with A Better Way as well as MAPC. And when I tell you guys, these community partners, they are the best community partners around. They go and they are on the ground doing the work every single day, MAPC, they are out on Wednesdays and Wednesday nights. You can find them at Claybrook and also on Summer Avenue. They do have Narcan. They will be happy to give you Narcan. Let's go out to one of their SSPs. Also, the Josh that you saw coming up here introducing and giving you the time to get off the stage. Josh is, he will provide training for you, your group, or anybody that may need training. He can do that for you, as well as A Better Way. Ron Vogel, he is the director of A Better Way, and he has a lot of his staff. They are already trained, and they can train you as well. So if you need training on Narcan, naloxone, you can seek out those community partners. Like I said, the health departments don't. We do not give out Narcan, and we can't train you, but they can. Okay, the Tennessee Department of Health has labeled Shelby County as a high impact area, with opioid overdose accounting for more deaths than fatal car accidents in 2017. In 2018, there were 854 opioid related emergency visits in the county. And in 2020, there were 416 overdose related deaths, which was an increase of 22% since 2019. And this is just a video.
Zoom ain't gonna be able to 150 people online, they're not gonna be able to hear you.
Okay.
Talking to the mic.
Opioids impact the city of Memphis. ABC 24's Jay Shakur breaks it down. Of the nearly 7 million Tennessee patients being prescribed opioids between 2016 and 2020, more than 838,000 of them were in Shelby County. That's just over 12% of patients statewide taking these prescriptions here at home. But how many fatal opioid cases have we seen? According to the Shelby County Health Department, in the first quarter of the last 2 years, 173 overdoses. So from January to March, 2021 accounted for 112 of them, and in 2020, 61. During this time, we were in the peak of the pandemic. Now, how does opioid deaths measure across Memphis and surrounding areas? As you can see from this chart, the city of Memphis holds the most cases, claiming 91% of deaths in 2020 and 86% of deaths in 2021. Now, you may see all of these other colors. Those represent the areas around us like Germantown, Arlington, Bartlett, Collierville, Middleton, and more. Now, these numbers are from the first quarter of the year. The health department has not yet released the remaining months.
Okay, so like he said, we have had a really high overdose in Shelby County. So when you say that that's a problem, Shelby County has a problem with overdose and overdose deaths. So we need to try to do something about this. And like I said, MAPC, they are actually out on the grounds every single day. A Better Way is out there as well. We also do stop events as often as we can. That's a event that we go out to the communities and we give out information about opioids and the harmful effects that opioid is having on the community. We also do different presentations for schools. We go into the schools as well, talking to the young kids because we're going to talk about this a little later, but we're finding out that opioids is really affecting our young children as well. And we're getting a high number of deaths amongst the young, our young kids. So Shelby County, we really have a problem with opioid overdose and opioid abuse. Like I said, the opioid epidemic in Shelby County is clearly a public health crisis. And we're going to listen to our very own Brad Yackett. He is a part of a Better Way. And we found this news story where he actually gave out information about the opioid epidemic and how it's affecting Shelby.
Now is what's behind the steep rise of opioid overdoses in Black men. Brad Yackett with nonprofit A Better Way says that job loss and the pandemic may exacerbate it.
We've seen the numbers raised drastically, especially in the African-American population. Maybe somebody had a prescription for oxycodone, they go to the streets because they ran out, and it's pressed pill with fentanyl. Drug addict survivor Brad Yackett says most of the time people can't distinguish the real pills from fake ones filled with opioids like fentanyl. Fentanyl's so cheap to manufacture, and the return on it is, that much more money in the pockets. So it's more about a greed thing. Yackett says before fentanyl was mass produced, you didn't see as many fake pills being sold. He hurt his back, and after his pain specialist lost his license, Yackett became hooked on pain meds, eventually switching to heroin. He's now in a 12-step program. Coming out of addiction, strips you of all your humanity. Question everything that, you really don't know how to tie your shoes some days. Now he's helping others overcome their drug addictions with nonprofit A Better Way.
What do you hear time and time again from people who come out of drug addiction?
That they didn't know that this type of life was possible. They thought they'd be, a prey to misery and depression their whole life. They didn't think they'd care, have fun again. In my groups, we go out bowling, we eat, concerts, you name it. Health officials say intense stressful periods like the pandemic can lead to an increase in adverse coping mechanisms. There is still such a stigma for an IV African user. We do serve several, but in large, it's frowned upon. So, maybe eating a pill that looks like it's prescription is not as stigma. So I think that's where it's coming into play.
Those who are using drugs may get combative and begin to isolate or display a change in behavior. A new exchange is then off Shelby Oaks Drive will be happening this Friday, beginning at 6 p.m. In the studio tonight, I'm Rebecca Butcher.
Okay. And like I said, that was our very own Brad Yackett, and he works with A Better Way. Woo! And they are there, they're out there on Sycamore View every Friday. Brad, are you in here? Woo, woo! There's Brad back there, and he is really doing great work. Also, as he mentioned in the video, we are seeing an alarming rate of opioid use that is rising in the African American community. And as you can see, it is now 50% Black males are the highest rate of opioid overdose. And following that is the Black female with 19%. Then the white male at 16% and white female at 10%. And 5% for other. So we try to get into these high impact areas where there is like I said, a drastic increase with the African American community of overdose. So we do stop events. We also do start events. We try to get in the community and go out there and hit the ground running, trying to give all the information out so people will be aware of what's going on. We have the fentanyl. Fentanyl has become a really a major problem in the communities. So I'm going to show you a video about fentanyl, and then we're going to discuss that.
The drug landscape has changed. Illegal fentanyl has made its way into the drug supply. And it's a danger you might not see coming. A synthetic opioid, up to 50 times stronger than heroin, up to 100 times stronger than morphine. It only takes the tiniest amount to cause a fatal overdose. A fraction of a raindrop, or 3 grains of salt. Your drugs don't come with an ingredients list. Fentanyl is being mixed into almost every kind of drug. You wouldn't be able to see it, or smell it, or taste it. Fentanyl is one of the most common drugs involved in overdose deaths. Know the dangers. Learn the facts about fentanyl and ways to protect yourself at cdc.gov/stop overdose.
Okay. Like I said, you all have heard all about fentanyl all day long. What is fentanyl? I know everyone knows by now what fentanyl is. Once again, it's a deadly synthetic opioid that is being pressed into fake pills and cut into heroin, cocaine, and other street drugs. Fentanyl is 50 times more potent than heroin. And like I was saying earlier, fentanyl, you see the pencil, that's just the amount that it can take to kill you. Just that little bit amount of fentanyl can kill. So we have to make sure that we are aware how little fentanyl it takes to actually harm you. This right here shows on the left heroin. That's the dose, lethal dose of heroin, and on the right is a lethal dose of fentanyl. You barely can see the fentanyl in the container. So if they are actually putting this in the drugs or on the street, you will have no idea that this is in the product or the drugs or whatever that you are actually buying off the streets. That's why it's so important to know the dangerous effects of fentanyl. Okay, fentanyl is abused and taken in an overdose. It can quickly be fatal because it's so potent, okay? There's a significant risk that any illegal drug that you buy on the streets can be contaminated. So you really don't know what you're getting when you're out there, when you're buying things on the streets. You have no idea what's in these pills because they are actually, like we said, they are actually repressing pills. They're putting the fentanyl in the pills to make them look like they are the real thing, which they're, you know, sometimes they may not be. And that's how we are getting all these overdoses in our city. The DEA announced results of enforcement surge to reduce the fentanyl supply across the United States. As part of the One Pill Can Kill initiative, the DA and its law enforcement partners seized more than 10.2 million fentanyl pills and approximately 980 pounds of fentanyl powder during the period of May through September. The amount of fentanyl taken off the streets during this surge is equivalent to more than 36 million lethal doses removed from the illegal drug supply. And as I was telling you all earlier, we are now having really surge of fentanyl in the community dealing with the young people. And this video is gonna show you, it's gonna tell you about the fentanyl that is coming into Shelby County as well as over the nation, dealing with young individuals as well.
This afternoon, 2 young kids in separate incidents that could have been deadly.
The kids nearly lost their lives after having fentanyl in their system.
Team 12's Chase Golightly spoke with the Drug Enforcement Agency and Valley pediatricians about this growing fentanyl crisis.
2 cases just days apart.
It's terrifying.
Phoenix police say in separate incidents, 2 babies were taken to the hospital for fentanyl overdoses.
That is a terrifying thing for everyone. Fentanyl is in your community right now.
DEA Special Agent Sherry Oz says as fentanyl continues to come in from over the border, these heartbreaking cases involving kids won't stop.
Keep these pills of poison and death outside the reach of your children, outside of your home.
According to the state health department, there have been 96 overdoses in kids ranging from 17 years old all the way down to newborns. When we asked how are these children getting into this incredibly dangerous drug, Special Agent Oz says in most cases, it's just in the house where they live.
If you ever have toddlers in your own house, there's nothing that's off limits. If it's in your house, kids are going to touch it. They're curious. They're going to look at it and things go in their mouth.
Police investigators say they did find fentanyl in the home where one of the children lived. In the other case, the father reportedly told authorities the child's mother was a user. Somehow the child found it and ingested it.
Because that's the way they learn it. So I think that's probably the mechanism of how younger kids are getting to it.
Dr. Gary Kirklis is a pediatrician with Phoenix Children's Hospital. He says when a young child takes fentanyl, everything starts to shut down.
Heart rate, respiratory rate. And if a child were to take one, it would decrease their respiratory drive so much they would go into respiratory failure.
And the window of time to save the child goes down significantly compared to an adult.
Really, time is very important that you start CPR or start giving Narcan.
Both Oz and Kirklis agree. Parents need to warn their kids about fentanyl. As for preventing these overdoses in young kids, Oz says there is really only one solution.
The way to save lives is by saying no. Don't bring these deadly pills into your home.
That data also shows that so far this year, there have been 372 opioid deaths in the state, which is significantly lower than the more than 2,000 we saw just last year. We're in the Alert Center. Chase Golightly, 12 News.
Okay, so as you can see from that video, it's very dangerous. The fentanyl is becoming very dangerous among young kids as well. So we just want to make sure that everyone knows the dangers of fentanyl, how it is coming into our community and how it's affected our young children as well. And the reason we say one pill can kill is because that's all it takes, one pill. One pill can actually kill. The drug cartel, they are now trying to entice the children with the rainbow fentanyl. I don't know if you all have heard about this. I'm quite sure you have. It has been all over the news that the fentanyl, they're making it, look like candy. And they're actually trying to entice the children to get them hooked on the drugs as well. And like we said, it only takes just a little, a milligram of fentanyl to be lethal. So we just have to make sure that we talk to our kids, we let them know about the dangers of fentanyl, have to let them know about, you can't take anything from anybody. It may look like candy, they may say it's good for you, just taste it. We have to educate our children. Education, education, education. Because if we don't educate our kids, they will get, they can get a hold of some of this. As you saw in the news story, the kids, if it's in the home, what's stopping the kids from getting it. So it's, you know, it's really, really important that we keep these drugs out of the home. First of all, don't even have them there. And then make sure that you keep them away from your children. We're going to talk about the stigma. You all have already heard about stigma and how it affects you, but we're still going to go over a few of these as well. Some of the effects of stigma include feeling ashamed, hopeless, and then you begin to isolate yourself. Reluctance to ask for help or to get treatment. You should always ask for help or try to get some kind of treatment. I mean, addiction can happen to anyone. No one is, it can happen to anyone. Lack of understanding by family. A lot of times when your family don't even understand you or your family don't want to help you, of course, that's very, it hurts and it's harmful. Fewer opportunities for employment and social interaction. If you can't get a job, that's something that is going to cause you, it's going to be a harmful effect on you as well. We have bullying, physical violence or harassment, self-doubt, the belief that you'll never overcome your illness. That's not true. We just, of course, we just saw with our own Brad. You can overcome your illness. You can fight this and you can get better. Self-esteem and mental illness is also harmful effects of stigma. Then we have the steps to cope with the stigma. You want to try to get treatment. There are different places out here where you can go to get treatment. Make sure you go and stop by all the vendors' table. We have vendors out there that will help you, that can help you sign up for different rehabs. So make sure you can get treatment. Don't let the stigma create self-doubt and shame. Like I said, it can happen to anyone. Probably a lot of our, a lot of people in here probably have family members or someone that is on drugs or, dealing with opioid addiction. So it can happen to anyone. Don't isolate yourself. You have a problem, you have a illness, it's an illness. So you need to get help for it. And don't equate yourself with that illness. It's an illness. It doesn't make you, it's not you, the person. You have an illness just like any other illness. You want to join a support group. Go and, talk to someone. They do have support groups. Join a support group. Have someone you can talk to about what you're going through. Get help if you're a student in school. They have counselors in school. You can go and talk to them and get help about it. And most of all, speak out against a stigma. If you hear someone that's bullying or someone is talking about it, speak out against that. We want to make sure that we try to help others so they don't feel like they have a problem or the illness is overtaking them. So that's what we want to do, and we want to continue to educate. Like I said, education is the key. You want to make sure you educate, you talk to whoever it is that may be on drugs or maybe that having issues with opioids. Make sure you talk to them. And education is the key. So that is our, if you know someone that is on substance abuse, make sure that you can give them the red line number. It's 1-800-889-9789. They will talk to them. They can actually call that number and you can get someone, a live person to talk to you on the red line. And like we said, opioid addiction can happen to anyone. And if you want more information about opioids, you can always visit our site at shelbytnhealth.com. That's the Shelby County Health Department site, is shelbytnhealth.com. And that's it.